Does one of your shoulders bother you more than the other generally?
Yeah, I think my left shoulder and my left side of my neck, like here, is probably my little annoyed area.
Okay.
Much of the time.
You see how I have a much different style with her than I did with you, Aaron, because you told me from the beginning that you liked more pressure, and I know Traci doesn't. And so I just start off super, super gentle with Traci whenever I work on her, and she's given me feedback enough times to know that she can relax much better if I start off super slowly and super gently. Pressing her scapula. If you have any questions, feel free to ask.
Sure.
So here's the medial border of her scapula, and I'm even going to palpate it slower. If I were to cross it on her as fast as I did on you, that would make her jump. I just know from previous working on her before that she has kind of a jumpy muscle right here. And it's already starting to melt. I'm probably using 1 pound of pressure here.
Gosh.
Why does that make you laugh?
My immediate thought was, I'm a wimp. But, yeah.
No, I don't think that at all. The brain guards, it has its own reasons and its own conditions under which it's going to stop guarding it. Each brain has a different set of standards of what's safe, and I need to find that out with each person. It has nothing to do with your... I don't even know what a wimp is. What is a wimp? Since you brought it up.
It's a negative word.
Yeah, what does it mean?
It's somebody who doesn't willingly endure pain.
Oh. So normal people willingly endure pain?
That's a perception of somebody who considers herself sensitive, so I perceive other people as being stronger, capable of enduring greater challenges or pain or discomfort. But I can see, if the goal is to help somebody melt their muscles, it's important to be on their level, like where they feel safe first. And that's how we gain the trust of the muscle to make progress with it.
Yeah, the trust, you say with the muscle, and that's one way of looking at it. I think of it as the brain. Because the brain's the one that has made the decision to guard the muscle, and the brain is the one that's got the keys to the muscle to decide if it's going to relax that guarding.
Mm-hmm. Yeah.
When you say yeah, is that because I'm in a good place? Right there with my thumb?
It is a good place, but I was saying yes to, that I understood what you were saying.
Okay. So I'm not starting off with my elbow here. I have used my elbow on Traci recently back here. I was surprised, but most days that's not the kind of pressure her muscles are calling for.
Mm.
And I feel the muscle softening and melting. Do you feel that melting, Traci?
A little, yeah.
A little is all we need. And as I feel her muscle continuing to melt, I begin bringing her shoulder back to neutral. It's kind of like a pin and stretch, but I begin pinning when the muscle is short, and I stop when the muscle gets back to neutral. I never take it into a stretch. Because I believe that stretching a muscle that's guarded is going to put the brain on higher guard, higher alert. Do you have any questions, Erin?
Not right now.
I have a question.
Okay.
So let's say this is the first time you work on a specific client and you don't really know you don't know their muscles yet, and you don't know their safety zone in terms of pressure. How do you proceed with your pressure? Like, how do you know or learn what's safe for their body and what isn't?
Well, what would you do?
I would listen, I guess, with my hands, and like maybe start gentle and then just kind of listen and see how the body responds, and maybe make adjustments as you go, and then maybe talk about it at the end of the session when you're done. Like, how was that? But mainly just listening. I mean, I've done energy work, so I kind of have that practice, I guess, and just being like really quiet with the body and kind of sensing with my hands.
How's this pressure?
It's nice. It's good.
It's not too challenging?
No, you can go deeper if you wanted to.
Why would I want to?
You could. I would be comfortable with you going deeper.
Do you want me to go deeper?
Yeah.
Yes, I agree with you that you have to start on the gentle end and gradually work your way up to more assertive with your pressure and your movements, because if you start too assertive and too much pressure, then the brain will trigger like guarding. Like, whoa, that's too much. And then once the brain has guarded, it takes minutes and minutes or hours and hours to get it to be unguarded again. So you want to start with motions and actions that are not going to trigger it to guard. And then and so that hopefully you stay under the guarding threshold for the whole session.
Mm-hmm.
Even if the person's begging you, go deeper, come on, go deeper. You know, sometimes I give them less than what they're asking for, because I don't want to risk their brain going like, ow, that's too much, and then they have to actually increase their muscle tension to guard against me.
Mm-hmm. So you want to always be in a position of trust with the brain or the muscles.
Yes.
Yeah.
And even when you asked me for more pressure, you didn't even exactly ask me. You said I could go deeper if I wanted. And then I said, why would I want? And you said, you would be comfortable if I went deeper. But you never actually asked me to go deeper. Mm-hmm. And I didn't. Until you actually said yes, deeper.
Yeah.
You know, it was as if you were trying to accommodate me. That my preference would have been to go deeper, and you were willing to accommodate me.
Mm-hmm.
And that's common. That's a common conversation that we have with people during massage.
The therapist knows more than the body does, or the...
Well, people assume that, yeah, and they always say you can go deeper if you want.
Mm-hmm.
Is it still feeling okay?
Yes.
Because it still feels like it's continuing to make progress and go deep and sink. My fingers are sinking deeper.
Yeah, it feels good. So that's like 2 pounds of pressure compared to Aaron's 30.
So that was the attachment where the lower trapezius attaches onto the spine, around T10 or something.